Hi everyone, how's it going? My name is Jeff and I'm an occupational therapist who practices in the United States, and I often work in the hospital with patients who have had a stroke. And today I want to talk about a topic that is pretty important and affects most people who have had a stroke, and that is balance. When you think about balance, most people probably think about when they're standing or walking and them not trying to fall over by maintaining their balance. But balance is a part of every day, even when we're sitting. And a great way to start working on your balance so that you don't have a fall when you start walking, such as with therapy, is to work on your sitting balance. And a sitting balance is a good kind of precursor to standing balance. And you may be thinking, well, sitting balance, that seems pretty easy, but some of you may have experienced even like trying to get out of bed can be very difficult, let alone like sitting on the edge of bed. So today I'm going to focus on sitting on edge of bed and their balances concerning that. And we're going to challenge our balance both from just sitting still and also moving about and kind of reaching around to challenge our balance as we sit. Even though it may sound pretty simple, I'll try to make it challenging and rehabilitative for you all. And one thing regarding safety is, as this is the internet, I'm just a stranger on the internet to you guys. I'm not there to, say, provide physical support, so I highly recommend that you have a spotter or a caregiver, a friend, someone in front of you or near you, so that if you were to lose even your sitting balance, they would be there to catch your fall, because I don't want you guys to get hurt as you're doing your rehabilitation and going along in your recovery journey. With that said, where should the spotter stand? Oftentimes when you've had a stroke, you have one-sided weakness, right? So the best side for them to stand would be on the side of your weakness. So if I were, for example, sitting here on the edge of the bed, it would be best for my spotter to stand on my right side, somewhere along either like right about 45 degrees from me, I would say is a good general rule. Not behind me, not to the left of me, and like basically they should be within arm's reach as well. So how do we even get in this position? The key is to do and try and put in the effort yourself. And it's easy, especially culturally, right, for family members and friends to want to help you and overhelp. And that is kind of like a balance. Like it depends on where you come from. Like some of you around the world may be more independent, like more Western culture. Where I come from, more Eastern culture, family members want to help. So I think no matter what, there should be somewhere in the middle where you should have the ability and freedom to try and do things yourself, but get help as needed, like I said, with like a spotter, right? So first, how do we even get in this position? Well, we're going to start from a laying down position, and most people, they often start off from their back side, and that's a good, just general all-purpose position for us all to start off in. If you are on your side already, then that's great. You can like fast forward. Your environment may be different. You may be moving towards your left side because, say, there's a wall on this side, and for example, I can't even go towards this side because there's a wall right here, right? So one thing to note is it may be beneficial for you if your environment allows to kind of move your bed around the room so that you can get out of bed on both sides. I wouldn't say one side is necessarily better than the other. Having both sides open would actually be best because it allows you to practice getting out of bed both towards your weaker side and towards your stronger side as well. So maybe you want to have a discussion with your spouse and maybe consider switching with them every now and then, and say it's for therapy and say Jeff sent you. Okay, so actually turning towards your weaker stroke side is actually easier, as I talked about in some of my other videos, because you have strength on your non-stroke side, and that allows you to use that strength to turn onto your weaker stroke side. As opposed to turning towards the wall direction, I don't have as much strength because it's the weaker side on my right side right here. So to initiate turning, not that it's impossible, it will be more challenging. The same kind of concepts can be used for both directions. there are kind of like small like little differences in how you can maximize the physics and like the body mechanics of it. However, just to keep things very simple for you all and for myself too as a therapist, I generally use the same kind of general strategies to get out of bed, whether it be left or right. The best thing to do is to kind of wiggle yourself to the edge of the bed, because if you were to turn and get out of bed and you're still in the center of the bed, you're still gonna have to do a lot of work to get towards the edge of the bed, right? That's how we get there to even do things like sitting. So one thing you can do is start by bridging yourself. And if you have like very limited movement, feel free to use your articles of clothing, or you can even grab onto your like leg. And what we're gonna do is get it so that we're in a bent knee position. And you can also use your strong leg to hold it in place, kind of like that. And reason being, when we have our knees bent like this, it's easier to kind of pivot and turn as opposed to being flat. And what we're going to do, those of you who have done bridging with me before, we're going to do a bridge towards our edge of bed. And how that works is we're going to just form a bridge and lift our bottom off the edge of the bed and simultaneously push and pretty much use all our muscles in our body to go towards one side. And feel free to do this in small increments. It doesn't have to be like one big push. You can do like 20 if you like. As long as you do it and get some movement and you're moving somewhat, I call that a win. So I'll do some small increments and movements for you guys just so you can see what that would look like. So from here, you can tell that I've deviated away from the pillow where I started from, and I'm pretty close to the edge. Now, I wouldn't want to go too far to the edge, because from the point where I start to turn and like sit up, if I'm too far off the edge, then, well, I can probably fall off. So it depends on your individual situation, what your bed is like, if you have things blocking you, if you have a bed rail, what your body size is and body type is. So there is no one sweet spot. Basically, I'm just recommending that you use your intuition and problem solving to figure out what will be best for you. For me, I think this is a pretty good spot for me to start initiating sitting up and working on my sitting balance. So from here is a good time to have your helper get off their phone or stop watching their television show and come nearby to spot you, just in case you lose your balance and have a risk of, say, sliding out of bed or anything like that. So from here, we're going to turn. And if you have nothing to grab onto, there's probably usually an edge of bed that you can grab onto. But what we're going to do is going to use all of our body, including our torso, to turn towards this side that we're getting out of the bed from. Whichever side is easier for you guys. Here we go. 1, 2, and 3. And we want to make sure that we brought our arm along too. So at this point, if your arm is like behind you, stuck under you, have your helper help you by kind of bringing your arm closer to in front of you. Make sure that they do not pull on your hand. Make sure that they kind of slowly guide your arm in front of you. And if they have a lot of trouble, you can kind of roll back off of it to make it easier so that you're not putting so much weight onto it. For me, I started out in a pretty good spot, so my arm is pretty well secure and accounted for. And then from here, we want to just bring our feet off to the edge. And this makes it so that it's dangling, and that kind of adds some counterweight to our body so that we're almost already kind of pivoting. If you were to imagine, oh, I don't know, like a seesaw, yeah, then this adds weight to the one side of it, right? Our legs. And our pivoting point is kind of like around here. I don't know, I'm not a physics major or physicist, so something along those lines, right? And now we can use our strong arm or both of our arms really to push off of this surface. And one tip is to have it so that we push from basically around here, because if you notice, if you push like that, it's not going to do much work. If I push too far down, that's not going to do much work. It's even worse. So there is kind of a sweet spot, and it's around, for me, it's around right here. So we're going to simultaneously push up and just kind of lower our legs, and you guys know I'll get up it. So let's do that. 1, 2, 3. You can see I required some multiple pushes. And at this point is a part where you want to have your helper really be aware and standing by, because this is where you can fall over. And one example of what this may look like, I'll demonstrate, is like this. We're getting up and we're up, and we don't quite have it, and we're back down. And so make sure that you are all safe when you're doing this. And at this point, depending on the height of your bed, this can be very, very easy or somewhat easy, difficult, based on where your feet are relative to the ground. For me, I have it so that my bed is not super, super low or super, super high. It's somewhere in the middle. So my kind of like, my toes are touching the ground. For some of you, if you have a really tall bed, your feet could be dangling right now, and that will make it actually harder. So to make it easier, you can have some support, like a, I don't know, like a shoe box, something firm, even a stack of pillows have under your feet so that you can have it firmly supported, just to start off real easy with our sitting balance. And one thing we can do is place our arm off to the side here and use it for support. And we're only going to use our stroke arm as we simultaneously work on our sitting balance. We're actually going to promote some recovery and function with our stroke arm. So a good place to put it is kind of like here, kind of like a tripoding it as for support. So just kind of get a feel for what it's like sitting up. And so for those of you, if you may be kind of lightheaded, dizzy, feel faint, I think a good idea is for you to get a drink of water, like drink a glass of water, and just go slow. And if you really, really lay down, then yeah, you can probably lay down and try again in a little bit. For most people, if they have been in bed for a long time, even like without a stroke, just other people who have laid in bed, it's just really hard to get out of bed because they become really like dizzy and lightheaded, because the body likes to move around, you know, believe it or not. We don't like to, as humans, we're not like bed kind of beings. So from here, we're sitting and putting weight through our right arm. And this could be difficult or easy depending on how your arm is. If it's really, really firm and what's the word, tense, what we call spastic, then it will require some gentle kind of opening up and stretching of it and putting it onto a surface like the bed. Now, if it's really, really floppy, you would definitely want to be careful and make sure you're not like putting weight on it in a funny way like this or something. Just something like this is a good one to start with. And also, there are many variables when you're sitting in this position that affect how easy or hard it is, besides your feet being on the ground. Another is the surface. So for me, this bed is actually quite soft and I'm sinking quite a lot. So I think a firmer bed is probably going to be more easier. You can imagine a bench is easier to like sit and hold your posture for, compared to something like a really soft like sofa or something where you kind of sink in. And those of you who have a mirror, this would be a great tool to have in front of you to see how your posture is and how your alignment is. Sometimes after a stroke, some people may have difficulty like recalibrating where their body is relative to space. So for example, they may think that this is actually straight up, and until you say bring them a mirror so that they can visually see themselves, they wouldn't even notice. Just like how you were probably told as a kid, if you had poor posture, to not slouch, most of us can probably benefit from sitting with a more upright posture, sticking our chest up. So if you can do that, do it to a pain-free kind of position and remember to breathe. So for those of you who are ready to kind of make things a little bit more difficult, now we're going to do unsupported sitting. So with my arm here, I'm going to, if you can, bring it onto your lap. If not, and you need some help, you can guide it with your other hand onto your lap. So that now my feet are still off the ground, and now I'm not grabbing onto anything for support. And if you're swaying, leaning, anything like that, have your helper help guide you, bring you back into what we call midline. And this is really going to challenge what we call our trunk and the muscles that are in our core. So if this is going pretty smoothly for you and you're not having issues with your sitting balance for our kind of frozen sitting, we're going to make things a little bit more difficult to challenge our sitting balance now. And this doesn't actually require any movement. All we're going to do is close our eyes, and we're going to maintain this position for about, I'd say 30 seconds to a minute. I'm going to go for a minute, so feel free to follow along. And if anytime you feel like you're losing your balance, open your eyes. Or if anytime, if you're the helper and you're helping the patient here, you see them losing their balance, tell them, grab onto them, tell them to open their eyes, and just don't watch them fall, okay? Here we go. Remember to breathe. Slow and deep. Okay, so that was a minute of sitting. How did it go? Was it challenging for you? Did you feel like you were swaying all over the place? Did you feel like you were pretty much stationary, but when you open your eyes, you ended up in a different spot? So what this also tells you is that when things get a little bit darker, when there is like no light, for example, when you are to move around in, say, the middle of the night to go to the bathroom, your senses may not be as up to speed as they once were. So that's when you want to be extra careful, either moving around, or you just want to turn on some lights or have some sort of lighting to help guide you. I don't know if you guys do it overseas, probably, right? Call it high five, and we're gonna just high five our partner here at different locations. So your partner will initiate and bring their hand up. I don't have a helper, so I'm just gonna do imaginary taps with a ghost in space. We're gonna just kind of work in this general space though. Kind of like if you were to draw like a big circle in front of you, we're gonna work in that space for where to high five. We're not gonna go all the way to the ground, like all, as I mentioned, work in a really close, safe space for now. Okay, to start, I'm gonna use my stroke hand to tap the 12 o'clock position relative to me. Come back to my lap, the 3 o'clock position, back to my lap, 6 o'clock position, back to my lap, 9 o'clock position, and back to 12. I'm gonna go back to 3, 6, 9, 12. One more time. 3, 6, 9, and 12. Now we're gonna have a much larger clock basically in front of us, and we're gonna do the same 12, 3, 6, 9s again, but much farther away. 12, 3, 6, 9, 12. Back to center. 3, 6, 9, and 12. Okay, let's make things a little bit harder. Now we're going to add some more hour hands to it. We're going to reach for 12. 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, and 12. Okay, a little bit of a mental exercise for you. Whatever time you think it is, where you currently are as you're watching this video, tap that hour hand first. So what time is it right now? I think it's about 9 o'clock for me. I'm gonna go for the 9. And then the minute hand, whatever time you think it is, actually don't know, I'm gonna cheat and look. Oh, okay, for me it's 9:40, so that's the 8. I'm gonna reach down for that. Ooh, okay, and back to center. So that was our sitting exercises, and to return back to bed, you kind of reverse the same thing you did to get out of bed. Okay, so now I'm back to the side lying position, and from here I can just push away and go back onto my bed. And you can straighten out your legs, maybe even put a pillow under your legs. And that's how we get from in bed to sitting on the edge of the bed and back. So as you can see, even something like sitting on the edge of the bed can be a very useful activity to help us to practice our sitting, to work on our reach, our stroke arm, our vision, our awareness of our environment when we close our eyes, our endurance. I'm working up and trying to catch up my breath, even from doing this myself. So thank you so much for following along with me. If you found this video helpful, please give it a thumbs up so that I know to make more of these kinds of videos. And also, of course, be sure to subscribe, as this is YouTube, to my channel so that you get notified when my videos get uploaded. Have a nice day, get lots of rest, and thanks for watching.